इस पे भी होगा ना व्हाट्सएप पे. Very good afternoon. Within a short span of time, we will start the session. I request everyone to please stay connected. Just within a few minutes, we will start the session. We are waiting for our new director, sir, to join with us in this webinar. So all are requested to please stay connected. Thank you. I request everyone to please keep their mics off. Just in a few minutes, we will start the session. We are waiting for our director, sir, to join with us today.
इसको देख लो बोलेगा गैस अच्छा वेबिनार का बोल दिया ना
डॉक्टर सत्यपाल सर प्लीज आपका म्यूट कर लीजिए
हेलो
सर Very good afternoon and warm welcome to all. सभी आदरणीय अतिथिगणों को नमस्कार. सभी आदरणीय गवर्निंग बॉडी मेंबर्स, आदरणीय गुरुजन, आज के सेशन के प्रवक्ता आदरणीय डॉक्टर संजय खेड़ेकर सर, सभी स्टूडेंट्स और सोशल मीडिया लाइव व्यूअर का मैं डॉक्टर मीनाक्षी जायसवाल एवं राष्ट्रीय आयुर्वेद विद्यापीठ की संपूर्ण टीम की ओर से स्वागत करती हूँ. A warm welcome to all the viewers in the journey of knowledge, Gyan Ganga, the 110th session of webinar series. I would like to pay sincere gratitude and pranam to our mentors, respected Padma Bhushan Vaidya Shri Devendraji Trigunaji, President Governing Body RAB, respected Vaidya Shri Manoj Nesri ji, Advisor Ayurveda, Ministry of AYUSH, and respected Dr. Kaustubh Upadhyay sir, Advisor Ayurveda, Ministry of AYUSH, also holding charge as Director RAB for extending their great motivation, valuable direction, constant encouragement for successful sustenance of the series. Today, as a speaker, we are blessed to have Professor Dr. Sanjay Khedekar sir from Nasik, Maharashtra with us. And today, he would be addressing us on the topic, role of Rasaaushadis in autoimmune disorders. Autoimmune disorders are the burning concerns of the sophisticated society, which need to be addressed well. Sir's contribution and experience in this area will definitely guide us to work upon.
Post-session in question answer round, you can raise queries, doubts, and can share your views as well. Now, I would like to welcome and invite our director, Dr. Kaustubh Upadhyay sir, for his welcome address. Please, sir.
मैं प्रार्थना करता हूँ वक्ता अपना संवाद शुरू करें. धन्यवाद.
Thank you so much, sir, for your valuable guidance. Thank you, sir. Now, I would like to share brief introduction of Dr. Sanjay Khedekar, sir. Dr. Sanjay Khedekar, sir, is a leading Ayurveda physician in neurological disorder, cancer, and diabetes. He is an associate professor in the Department of Rasashastra and Vaisheshika Kalpana in Saptashrangi Ayurved Mahavidyalaya, Nasik, Maharashtra. He is a researcher and manufacturer of Ayurvedic medicines and founder of Arya Ayurvedic Pharmaceuticals, Nasik. Respected audience, his journey of academic career is full of merits and awards. He completed his BMS from SSAM and H Nasik in 2004. He is ranked first in all merit list of PG entrance exam in 2006 and chose Rasashastra and Vaisheshika Kalpana for his higher education.
Sir, Director, and all the committee members or key members of the for inviting me for this conference.
Yes, sir.
Hello?
Yes,
Okay, okay.
yes, sir.
So basically, the autoimmune disorders is the burning issue for this century, and from the previous 20 to 30 years, the number of cases for autoimmune disorders are increasing day by day. So basic concept for the autoimmune disorders, as shown on slide, an autoimmune disease is a condition in which your immune system attacks your body. The immune system usually guards against the bacteria and viruses. When it seems these foreign invaders, it sends out an army of fighter cells to attack them. Usually, the immune system can tell the difference between the foreign cells and your own cells. In an autoimmune diseases, the immune system mistakes part of your body, like your joints or skin, as foreign, and it releases proteins called autoantibodies that attack healthy cells. Some autoimmune diseases target only one organ, like type 1 diabetes damages the pancreas. In other diseases or disorders like systemic lupus erythematosus or lupus can affect the whole body. Again, the psoriasis, the rheumatoid arthritis, etc., the same conditions in which autoimmune disorders get completely in the body. So the basic causes for the autoimmune disorders. See, according to modern science or according to medical science, the specific causes for autoimmune disorders not revealed till date. These are some causes which are assumed to be basic causes for the autoimmune disorders. Among these causes, the very first cause, that is a Western diet. The Western diet, which is not but fat rich diet or carbohydrate rich diet, like junk food, etc. Second thing, which is again agriculture chemicals, pesticides, etc., are assumed to be cause for autoimmune disorder. Some medications like antibiotics, steroids, etc., are again assumed for the causative factor. As a causative factor, having relatives with autoimmune disease, yes, hereditary aspect is there again in autoimmune disorders. Smoking or nicotine is again considered as causative factor. Already having one autoimmune disease. See, this is the very basic concept, basic consideration for autoimmune disorder, that if a patient having a one autoimmune disease, he may get he may have a higher risk for developing another one. Like a patient having a rheumatoid arthritis, he may get next disorder, ulcerative colitis or psoriasis or etc. Exposure to toxins, toxic material like air pollutant, etc., or the hello, hello, okay, okay, okay. So yeah, ma'am, I have already clicked. So, exposure to the toxins, the many of toxic material are considered as a causative factors. Ultraviolet radiation from sunlight, obesity is another cause for these types of disorders and diseases. Infections, some bacterial and viral infections are considered to be the uh, predisposing factor for the autoimmune disorders. Nutritional disorders, see, this is a very basic ideology behind these autoimmune disorders, that few nutritional deficiencies like vitamin B12 and D3 deficiencies are considered as a visiting factors, predisposing factor for autoimmune disorders. And we will see the basic concept for vitamin B12 deficiency or vitamin D3 deficiency. See, all these conditions are considered under the umbrella of gut-brain axis theory right now. The modern medicine or the medical science right now considering that second brain, that is the gut brain, as a causative factor for many types of lifestyle disorders. In this system, B12 deficiency and vitamin D3 deficiency are not only due to the direct deficiencies of these vitamins or due to the deficiency in the foods, but due to the predisposing conditions in the gut that are like hyperacidity or gastritis or gastric ulcer or prolonged hyperacidity or prolonged gastritis, gastric ulcers, etc. causes to leads to the vitamin B12 deficiency, and again vitamin B12 deficiency leads to the absorption of vitamin D. So this vitamin D3 deficiency basically gets due to the deficiency just due to the worst condition inside the gut or the gastritis, etc. the conditions. So basically the ideology of AYUSH or Amlapitta or Aamvaat, these conditions are get fulfilled here also. These are the causative factors which we can consider as again for the Ayurvedic concepts also. So in short, there are three, this is the triangle of causative factors of autoimmune disorders, or the conditions which we can say that these conditions having predisposing factors for the autoimmune disorders: genetics, second thing gut dysbiosis, and third one environmental factors. All these factors are basic causative factors for autoimmune conditions or disorders. Common symptoms of autoimmune disorders are there: fatigue, ache muscles, swelling, redness, low-grade fever. Slide is moving now, madam. Hello? Hello? Okay, ma'am. Yeah. So this is the autoimmune causes of autoimmune disorders. This genetics, according to the three conditions, three factors are there: genetics, gut dysbiosis, environmental factors. All these are the basic causative conditions for the autoimmune disorder. Common symptoms. Okay, ma'am. Is it okay, ma'am, right now? Hello? Where screen is moving right now? Okay, ma'am. So there are common symptoms of autoimmune disorders shown on slide: fatigue, muscle ache, swelling, redness, low-grade fever, trouble concentrating, numbness, tingling in the hands and feet, hair loss, and skin rashes. These are the basic common symptoms considered in all types of autoimmune disorders. Autoimmune disorders, these are the pictorial presentation, that is the organs of the immune system in our body: tonsils, adenoids, thymus, lymph nodes, appendix, bone marrow, and spleen are considered as organs of the immune system. And these are the basic consideration, like the multiple sclerosis, systemic lupus erythematosus, rheumatoid arthritis, joint pain, and impaired pulmonary functions and myocarditis are considered as complications of the autoimmune disorders. So common autoimmune disorders are like diseases of the joints and muscles: psoriatic arthritis, rheumatoid arthritis, systemic lupus, and then diseases of digestive tract: Crohn's disease, celiac disease, ulcerative colitis, diseases of the endocrine system: Graves, Hashimoto, Addison's, diseases of skin, psoriasis, etc. See, these are many types of autoimmune disorders. Total 84 or more than 80 conditions are considered as autoimmune disorders. Out of them, this some of 20 to 24 disorders are very common in as considered as autoimmune disorders. So basic aspects of the autoimmune disorders according to Ayurveda. See, first of thing, that is a Jor Upadra, another one is Viruddhahar, third one is Garavish. All these conditions must be considered or should be considered as a predisposing factors for or hetu for the autoimmune disorders: Jor Upadra, Viruddhahar, Garavish. When all of these get consumed, or all of having patients having these types of hetus, the patient Agni get Vikrut. This Vikruta Agni leads to the Dhatwagni Vruddhi. That Dhatwagni Vruddhi leads for the Dhatupaka. The Dhatupaka, for Dhatupaka, Bhavaprakasha have mentioned some symptoms of Dhatupaka, that are Gaurava, Vistamba, Rudistamba, Aruchi, etc. Conditions were mentioned by Bhavaprakasha. So basically, Jwara right now in this condition from 2 to 3 years after post-COVID, we have seen the increase in the number of autoimmune disorders in the patients after post-COVID conditions, which is nothing but according to Ayurveda, which we can consider as a Jwara Upadrava or post-Jwara conditions. Second thing, Viruddhahara, the conditions which we have seen many times, that Viruddhahara is considered to be delayed manifestation of disease in the body. Garavisha again having same pathophysiological aspects. So according to Charaka, he has mentioned that Ahar Sambhava Vastu Roga Char Sambhava. It means the Ahar, if you have quality food with Matravat Ahar, it leads for the good physical condition. If having a deteriorated food, or if having a asamyak ahar, it leads to Vyadigrasta Sharir. So, and then again he told that it is not necessary that every condition of the due to the Viruddhahar or due to the Apatyakaraka, we are nothing, don't create the disease very fastly, but sooner or later, after some times, or according to the Vyadi Samurchana and doshas, Sthana Samshraya or the Srotas get vitiated, then the manifestation of disease get manifested in the body. So delayed manifestation of disease is there due to the Desha Kala Sanyoga Virya Praman Ati Yoga Vyas, etc. Viruddhar, the disorders were mentioned due to the Viruddhara, that Shand and Visarpa, the Udara, Vispota, Unmada, Bagandara, Murcha, Mad Admana, Galagra, Pandav, Amavisha, etc. Kilas, Kushta, Grahani, Shotha, Amlapitta, Jwara Pinnas, Santana Doshasya, Mrutyo, Viruddhanam Pravadanti Hetu. So Viruddhana can be considered a basic positive factor for all these types of a disorder, which I have assumed that we can consider them as a predisposing factors for autoimmune disorders. Again, Visheshan of Agni, the causative factors for the Visheshan of Agni were mentioned in the Grahani Chikitsa by Acharya Charaka, that Abhojanat, Ajirnat, Ati Bhojanat, Vishamashanat, Asatmi Guru Shita, Ati Yuksha Sandushta Bhojanat, Vireka Omanasneya Vibrama, Vyadikarshanat, Deshakala Rutuva Shemat, Veganam Chividarnat, Dushtatyagnim Sadushtvanam Pachatit, Natat Pachati Lagwapi, Apachamanam Shuktotom, Tattanam, Visharupatam. So basically, it is autoimmune disorders. There is basic consideration of lifestyle disorders, and these lifestyle disorders nothing but due to the Vikruta Ahar and Aprakrut Ahar and Aprakrut Vihar. So these are the conditions which were mentioned by the classical text. Associated disorders of Annavisha, due to the vitiation of Agni, what we can consider that Sansrujimanam Pittin Dahan Trishna Mukha and Janatamla Pittam Cha Pittajan Chaparangada. These conditions are mentioned in the Grani Chikitsa by Charakacharya. So what is again the concept of Garavisha? See, Garavisha concept was before 2000 years old. Garavisha concept is considered as the toxic materials were given by some persons to the another healthy person, that is considered as a Garavisha. But right now in this era, we can consider Garavisha as a pollutants or toxic material or environmental changes or climatic changes or chemicals, pesticides, etc. We can consider them as a Garavisha right now, because this toxic material is again also get considered as remains in the body for longer duration, and slowly but steadily converts the healthy tissues or healthy organs to the diseased one also. So right now, the pollutants or the toxic materials or the pesticides, etc., the chemicals, the extra use of the chemicals, we are considering for as a Garavisha Hetu. And this Garavisha, which this symptoms of Garavisha were mentioned by Charak Samhita, त्याच्यात पांडु कृश अल्प अग्नि गरश्चापि उपजायते मर्म प्रधान आत्मानं श्वेतुम हस्तपादयोः जठरम ग्रहणी दोषो यक्ष्मा गुल्म क्षय ज्वरा एवं विधस्य चान्यस्य व्याधिर्लिंगानि दर्शयेत. It means not only these types of lakshana or these types of vyadhis are due to the Garavisha, but there are many other disorders again are possible due to the Garavisha. So basic consideration for today's era, the Garavisha we can consider as the side effects of modern medicine also, the toxic also, the pesticides, the pollutants, the toxins like heavy metals, etc., etc. We can consider them as a Garavisha, and this Garavisha leads to Aamvaat or leads to the autoimmune disorders in our body. Again, the which we have considered the Aamvaat hetu, that is abhojanat, atibhojanat, ajirnat, etc., etc. These Aamvaat hetu again we can consider for predisposing factors for autoimmune disorders. And the first one, the basic consideration of uh, viruddhahara. So these are according to this condition or this era or this century, we can consider as a extra fat-rich product, carbohydrate-rich product, the environmental factors. All of these conditions are very aggressively creates the hetus inside the body for the autoimmune disorders. And again, Aamvaat and diabetes. So in the Charak Chikitsa 28, that is Vatvadi Chikitsa, Charaka mentioned that for the Aamvaat treatment, you can consider the treatment protocols of Prameha, Vaat or Med. Prameha anti-diabetic treatment protocol of Charakacharya, anti-Vatahar treatment and Medagni treatment can be considered for a Aamvaat. So when we consider as a big umbrella, we can consider it as a Aamvaat just due to the factors of Viruddhahara, Aamvaat factors and Garavish. So all this, according to my consideration, all these predisposing factor I consider for autoimmune disorders. Now we can go for Rasaushadis for autoimmune disorders. How we can consider use of Rasaushadi? See, in Rasaratna Samuchaya, during the consideration for the gunas of Abraka, he mentioned that Pradnya Bodhi Deepanam. For Vaikranta in Maharasa group, he mentioned that Pradnya Pada Dipta Agni Kruta. In Makshika, he mentioned that Tat Sevana Jaravyadir Vishayana Paribhuyate. So these types of gunas were mentioned by Rasaratna Samuchaya. According to my consideration, maximum rasa medicines are to be considered as a Deepan or Agni, having quality or having a guna of Agni Ruddhikar or Agni Deepan. Maximum rasa medicines. But from all these medicines, I have considered as Pradnya Bodhi Deepanam. Pradnya Bodhi, here I have considered that vision behind the Pradnya Bodhi, it may initiates the not only for the Buddhi, consider the Buddhi Vardhan, but it actually, according to my consideration or according to my clinical exposure to this subject, I have considered at it as a Pradnya Bodhi means it directly acts on the pituitary gland or hypothalamus conditions. Abraka having very good qualities to get results in the endocrinal disorders. Again, Vaikranta is having same manifestation, Pradnya Prad and Dipta Agnikrut, both having very great quality to create the Agni Deepan property, and Makshika having anti Visha means it having a anti-poisonous property, that is Visharna Paribhuyate. So basically from the Maharasa group, Abhraka, Vaikranta and Makshika having great potential to fight with the autoimmune disorders. Then Shilajita. For the qualities of Shilajita, Rasratna Samuchaya mentioned that Sajvara Pandu Shopa Shamanam, Mehe Agni Mandyapaham Meda Chedakaram. And again, he had told that the Rasoparasa Sutendra Ratnalo Eshute Guna Vasanti Te Shila Dato Jara Mrutu Jigisha. So directly the conditions which we have seen in the autoimmune disorders, like there is a Sajvara, it means feverish condition, or Panduta or Shopa, it means the edema or inflammatory conditions in the body. All these for these conditions, Shilajita is a better option for all types of the patients. And again, the Abhraka, Vaikranta and Makshika. See, Abhraka having number of minerals or number of elements inside it. Vaikranta having again this such a mineral having number of elements. But in the Makshika, there are two basic composition of the two best metals, that is a copper and iron. Chalcopyrite, we can say chalcopyrite. Instead of using tamra directly for the treatment purpose, or instead of using iron directly for the treatment purpose, we can consider Makshika as a best treatment protocol, because it contains both copper and iron. And according to the Loho and Tamra, we get the sulfur also, and many number of trace elements are there in the Makshika. So Makshika having very great potential for number of disorders. But here, considering autoimmune disorders, we can consider as a best medicine for autoimmune disorder Makshika also. And according to me, the Tapedi Loha, which was mentioned in the Charak Samhita, I hear in the Pandu Chikitsa that it considered as a Swarna Makshika, Ropya Makshika, or Ropya Bhasma. Again, Shilajitu in the and Mandru Bhasma is there, and Vidanga, Chitrak, etc. Other herbals are there. So, Tapedilo, Ropyukt or Tapedilo without Ropya, we can consider in which there are Makshik is there, and again Ropya is there, and again Shilajita also is there. So, for autoimmune disorders, drug of choice, as per my consideration, should be Tapedilo when we are considering the concept of using Makshik or Shilajita, or both when we are considering the Shilajit and Makshika for the treatment purpose, we have to we can choose Tapedilo will be the best option for the treatment. Next, Varatika, Moktik and Praval. These are the calcium containing preparations of the Rasashastra, and you can see that all these having a Gunatmak consideration in that Parinamadi Shulagni, Grahani Kshay Nashini, Kapapitta Kshay Dvansi, and Pravala Kshay Pittastra. That these calcium preparations are mentioned in the degenerative disorders for. So, and when we are considering the vitamin D deficiency or B12 deficiency in the patient due to the hyperacid gastritis or Amlapitta, etc. In these conditions, Amlapitta the basic cause behind the vitamin deficiencies or mineral deficiencies, there are the conditions like Amlapitta or gastritis or peptic ulcer, gastric ulcers like this. And in these conditions of Amla Pitta, this type of calcium preparations of Ayurveda, Rasashastra, Varatika, Moktik and Praval having a very great results for that ulcers or ulcerative conditions in the body. If when these ulcers or gastritis or gastric ulcer or Amla Pitta get relief, this may leads to the good absorption of the vitamin B12 and the vitamin D3, and then we get quality results in the autoimmune disorders. So, the basic consideration behind using the Varatika, Praval and Mukta is that the Amla Pitta conditions like Amla Pitta and Grahani, we have to choose these preparations. And for the Moktik and Pravala, I have considered there is a Mukta Pishti or Praval Pishti having very great results considering the bhasmas or above the bhasmas, and the drug which contains all these medicines for the drug of choice, which is a Praval Panchamrut, having a Praval Mukta Balshanka Shukti Kapardika. All these calcium conditions are containing material is there in the Praval Panchamrut. So when a drug of choice for these conditions or Amla Pitta or Amajanya conditions in the gut or in the Antragat Am, we can consider for Praval Panchamrut. Again, we can consider Praval and Mukta also here. And Mukta having very great capacity of regeneration. I have considered that the Mukta as a Garbha inside the shell, that is Mukta Shukti. There is a Garbha which is we can consider as a Mukta. So this Mukta having a very great potential of regeneration capacity. So if there is a mucosal thinning or mucosal gastric mucosa is destroyed due to the other toxins or due to the junk food or etc. or the conditions of ulcers, so their regeneration of a mucosal layer can be we can achieve by the using Mukta Pishti. So Mukta Pishti is having very great potential of regeneration capacity in many tissues, for the many tissues and the many organs. Again, the Gandhaka. Why it is considered as a drug of choice for the conditions of Aamvaat or Aam? You can get surprised due to the Rasratna Samuchaya mentioned a great quality of Gandhaka. Here he mentioned that Kandu Kushta Visarpa Dadru Dalano Diptanala Pachana. See, there are many drugs having a property of a Diptagnikrut or mentioned like a Dipan property, having Rasaaushadi having a Dipan activity. But very few products are there, or very few medicines are mentioned directly in the Rasashastra having a Pachan activity also. And Gandhaka is one of them that having a Diptagni and Pachana properties. Again, he had mentioned that Ama Unmochana Shoshana. See why Ampachakvati contains the Gandhaka, because the property of Am Unmochan and Am Shoshan, it means expelled out the Am and to absorb the Am from the tissues or from the body. This property has manifested for the Gandhaka. So Gandhaka is a very great product in the Rasaaushadis. We can use it many types of autoimmune disorders, and basic drug for the from this drug, that is a Gandhaka, that is Ampachakvati, which contains the Gandhaka, and all types of Rasindura and Gandhak Jarna based preparations are used for the, we can use for the treatment purpose. For consideration of Gandhaka, we can consider as all types of Rasindura, that is Samgun Rasindur, Dvigun, Trigun, Chaturgun, Panchagun, Shadgun Rasindur, and the Gandhak Jarna procedures like Pottali Kalpana or Parpati Kalpana or Kopi Vokarasan, etc. or Samagun, Dvigun, Trigun, Kajili also are there. So, but basic consideration for the using of the Gandhaka for the autoimmune disorder, having a great quality of Am Unmochan and Am Shoshan. So, here and then I can say that the best quality product, the drug of choice for autoimmune disorder, we consider as a Gandhaka, but the best quality drug we can consider for the autoimmune disorder is nothing but Swarna. And why Swarna? Because in the Charaka Samhita, for Garavisa Chikitsa, Charaka Samhita in Charakacharya told that Shuddhe Rudi Tata Kshanam Hemachurna Siddhapayat Hema Sarva Vishanyashu Garanchem Vinichedi. All types of Gara Vishajanya Vyadis or all types of toxic for the Vishachikitsa, gold is considered as a best medicine by Charakacharya. And all this followed by this all Rasa text books also that consider the Swarna as a best treatment, best Rasaushadi for a Vishanashan or a Gara Vishanashan properties. And which types of product we can use for this autoimmune disorders? First, directly as a Swarna Bhasma with other herbs. Second thing, Swarna Kalpas. The Swarna Kalpas like Swarna Malini Vasanta, Protva Chintamani, Vasanta Kusmakar, etc. All these Swarna Kalpas we can use for the treatment purpose. and all types of Makar Doja. All types of Makar Doja, it means that Vigun Balajat, Trigun Balajat, Makar Doja, or Shadgun Balajat Makar Doja, or Siddha Makar Doja, or Purna Chandra Dorasa is also there. So we can use all types of Makar Doja for the treatment purpose, which not only contains the mercury, sulfur, and Swarna also. So to use as a medicine, great medicine, we consider Swarna for the treatment purpose in the autoimmune disorders. Swarna not only gives recovery in the Garavish or other or from the other toxins, but also Swarna and all these medicines which we have considered for the treatment purpose, that Abraka, Vaikranta, Makshika, Shilajatu, Varatika, Praval, Mukta, Gandhaka and Swarna, having great potential for the baladhan in the patient, to increase the bala of the patient. All these medicines having the great potential, and out of them Swarna having great quality to increase the bala of patient. Because in autoimmune disorders, due to the, we have considered it as a Agnimandya, and due to Agnimandya, Dhatu Agni Ruddhi to Dhatu Paka, and due to Dhatu Paka, there are number of conditions which reveals that is a Vat Prokopa, and due to Vat Prokopa there is Ojakshay. Due to Ojakshay, we can see that there is a Balahani, and to increase the bala of the patient, to increase the Oja of the patient, to remove the vitiated doshas, we need to give the bala to the patient, and for this baladhan process, Swarna is having very great potential. And not only Swarna, but the remaining kalpas we have considered as for the treatment purpose, having also the same properties to increase the bala, but out of them Swarna having great potential. And next, which is the booster drug, or we can say that pinpointed drug or Vyadhi Pratyanikatva, having the Vyadhi Pratyanik drug, we can say consider it as a Trimalla. Trimalla means Harta, Manashila, and Somala. What is the properties of these Trimallas or these Hartal, Manashila, and Somala? According to the classical text of Rasashastra, they have mentioned they having the property of Ama Shoshan and Ama Pachana, like Gandhaka, because all these the Hartal and Manashila are Gandhak containing kalpas, or Gandhak containing medicine minerals, and Somala is a separately. But when we are preparing the medicines from the Somala, it again get converted to sulfides due to like Samir Pannaga, Malla Sindur, Tal Sindur, etc. Then again we convert Somala into sulfide form. So basically Hartal, Manashila, and Somala, we have to use them for Ama Shoshan, Pachan. These three drugs having Vyadhi Pratyanik action in the autoimmune disorders like Ankylosing Spondylosis, Rheumatoid Arthritis, or psoriatic conditions, psoriatic arthritis, myasthenia gravis, multiple sclerosis, etc., etc. In all these conditions, all these three medicines having great results. And which form we can use for the treatment purpose? Nothing but a Samir Pannaga, Swarna Samir Pannaga, Malla Sindura, Tala Sindura, Shila Sindura, like kalpas, we can use directly for the treatment purpose. We can see few cases which I have treated and with using these types of Rasaushadi. So cases are ankylosing spondylosis, rheumatoid arthritis, and deep vein thrombosis, ulcerative colitis, rheumatoid arthritis, and urine microalbuminuria. So these are actually complicated cases, all these. So just we can see some cases here. See, this is a patient, female patient, 28 years old, history of 4 years of ankylosing spondylosis. Symptoms mentioned as below. This case paper was published in the All India Journal of Case Reports. You can see that whole case paper is there. See the biochemical parameters. The patient having vitamin D deficiency at the 11, 18, and in the 21, 3 months after the giving the treatment for 3 months, the patient's vitamin B12 level was markedly increased. CRP level was 11.3, which was markedly reduced after the treatment. ESR level was 64 before treatment, which was considered decreased after the treatment. Vitamin B12 level was 282 before treatment, and after treatment it was markedly increased 3 months after 670. Domain, the results. These are the actually scales which we have used for the analysis purpose after treatment. The patient's pain was reduced markedly, percentage relief 89%, spinal mobility was 91.3% after the treatment. Affected peripheral joints found relief, 100% relief was found in this. Enthestasis, around 83% result was found in the stiffness, 85% was found relief. Acute phase reactants were found 88% is relief, and fatigue was found 91% relief. So these scales we have used for the treatment purpose also, and analysis purpose, and found very great significant result in the patient after the treatment. So, and again this is the picture of the radiological consideration. Sarcolithiasis was there, that the two sacral bone and the L-shaped bone was found adjoining, and this is the radiological picture after the treatment of the patient. Here there is the enthesis was found reduced in the patient after the treatment. So basically within the 3 months patient got the almost complete relief in our symptoms due to the Rasaaushadi. And what was the treatment protocol for the first month we have followed? That is, a Trayodash Shangukul was given. Again, Mahasudarshan Ganavati was given. According to Mahasudarshana Churna or Mahasudarshana Ghana or Mahasudarshan Kasha, having a very great results in the autoimmune disorders from the herbal medicines. And then Dashmurashta was also given to the patient. And in the Rasaushadi purpose, I have used Swarna Samirpanna 15 mg, Pravalpishti, Pipli Mula, Ashwagandha, Nirgundi, Pushkarmul, Erandamul, and Punana for the first month. And treatment was frequency was dose was the twice a day with honey was given. In the next month, treatment protocol was slightly altered. The Dashmurashta was removed and Saraswatarishta was added. Why Saraswatarishta? Because in the autoimmune disorders, many times we have seen the patients having insomnia or the anxiety like conditions. For this purpose, Saraswatarishta was added. And again, for the neural or neurological considerations, we have added Saraswatarishta. And then Mahasudarshan Ganavati was continued, but Dashmurashta was removed. And instead of Pravalpishti, we added Praval Panchamrut in next treatment, and Swarna Samir Pannak was continued. And again, Panchatikta Ghrudukukula was added for the treatment purpose. So this was the protocol we have choose for the next 2 months. And after patient getting almost complete relief, the treatment protocol is discontinued. My humble submission here is that when we are using Rasaushadis, we should consider them for a smaller duration or small dose, and for the very small duration also. Because if our medicines are working at their best, we should go for next treatment with the herbal medicines, because all these medicines which having a very good results are considered to be having some side effects also. So basically, without getting any side effects from the medicines, we should consider for the smaller duration of the and small dose and smaller duration of the medicines of Rasaushadi. See, this is the case of the deep vein thrombosis. Patient having rheumatoid arthritis from 12 years and hypertension from 7 years. Patient was male, weight 68 kg and Pitta Pradhan Kapha Prakriti. Hetu was sudden psychological shock, stress, depression, and other Prameya Hetu or Aamvaat Hetu were there also. Patient completed with deep vein thrombosis from 18 months. A patient following the treatment of standard rheumatoid arthritis treatment, hypertension, and DVT treatment by modern medicine. Patient was treated with the medicines like Swarna Samir Pannaga 30 mg, Pravalpishti 30 mg, Ashwagandha Tulsi Rasna Trikatu. one regime. In another regime, the patient was treated with the Tala Sindhura 15 mg, Mukta Bhasma 20 mg, Gokshur, Kokilakshi, Jatamans, and Guduchi. And another treatment was given, that is a Tilanalak Shara 15 mg, Vanga Bhasma 60 mg, Pipli, Shunti, Vidanga Sariva for 2 months. And for the common purpose, Sarivadya was given 30 ml TDS dose. Here, Rakta Prasadana was considered due to the different thrombosis. Rakta Grathitva was there for the Rakta. So, for Rakta Prasadana purpose, we added Sarivadya 30 ml for TDS dose for the treatment purpose. For first 2 months, we have given the Swarna Samirpanna, Praval Pishti, and Ashwagandha. For next month, we added Tala Sindhura, Mukta Bhasma, and Gokshura. So, after getting the improvement in the color Dopplers, I think I have not here color Doppler images are not there. So, patient got result in these conditions, and then treatment was discontinued after the treating the patient for next 6 months. For next 6 months, only Sarivadya was continued for the treatment. This is the case of ulcerative colitis, male, weight 56 kg, known case of diabetes from 5 years, ulcerative colitis from 1 year, Prakruti Pitta Pradhan Var, Hetu, hotel food from last 7 years, because he is living in the other country and having no other sources of the food. So I have considered as a basic Hetu for the this disorder, that is a hotel food. And incomplete sleep and stress is also there, because he is actually driver, cab driver. And Ayurvedic diagnosis, according to me, upon Avrutta Kapha, for the treatment purpose, we started Yashada Bhasma 30 mg, Swarna Sindhura 20 mg, Mukta Pishti 30 mg, Kutaja, Bringaraja, Amalki, Kokilakshan, Daruaritra. For the second month, we added Trigunmakar Dwaj instead of Swarna Sindhura, Praval Pishti, Loa Bhasma, Sariva, Saped Musli, Ashwagandha, Jatamansi, Shankapushmi. So here the first consideration was that the patient get Baladhana. Because due to the ulcerative colitis, the basic concept is that patient having a balhani, and to increase the bal of the patient, we consider the gold preparation directly here. First, we use Swarna Sindhura. After getting better results, we added more potent form of the Swarna Sindhura, that is the Trigun Makar Dwaja. According to the Gandhaka Jarana, the Samagun Balijarita Makar Dwaja or Samugun Balijarana or Samugun Gandhaka Jarana, the Dvigun Gandhak Jarana is more potent than Samugun Gandhak Jarana. The Trigun Gandhak Jarana is more potent than Dvigun Gandhak Jarana. So, to increase the potency of our drug, we use Trigun Makar Dwaja for the treatment purpose. Instead of Mukta Pishti, we added Praval Pishti and Low Bhasma. I have already shared that Mukta having a great potential of regeneration. When getting the result in the regeneration capacity or the patient's relief in the symptoms, we stopped the Mukta Pishti and added Praval Pishti. And then for the low Bhasma, see this, we have considered them because the Mukta Pishti is some costly from by Praval Pishti. So for the cost effectiveness, we stopped Mukta Pishti and added Praval Pishti instead of Mukta Pishti, because the initial results are very encouraging. So for the next results, we have considered Trigun Makar Dwaj and Praval Pishti. Low Bhasma is there, Sariva, Saped Musli is there. See, then the Rakta Prasadam, for the Rakta Prasadam purpose, we added the Sariva, and then the Jatamansi, Shankapushpi. These are the Medya products. Again, we use because I have told that the neurological manifestations or the there is a many in many patients they having the anxiety and the sleep disorders like them in the autoimmune disorders. To get relief from these symptoms, I start Jatamansi, Shankapushpi, Brahmi, etc. Medya Dravyas for the treatment purpose also. In the third month, after getting almost encouraging results, I started the Swarna Bhasma 10 mg, Mukta Pishti 30 mg instead of Trigun Makar Dwajan, Praval Pishti and Low Bhasma. And then Shankapushpi, Vidari, Sariva, Manjista, Haridra were added. And for the common treatment purpose, Bhrungaraja was started 20 ml in TDS dose. Because Bhrungaraja having very good results in the Yakrutagat Vikara, and also Antragat Vikara. So for this purpose, Bhungaraja was added, and in last month, Swarna Bhasma was started. Step by step, the potency of the medicines I have used here or increased to get the good results in the patients. Treatment for next 4 months for the ulcerative colitis. After completing the 3 months model, we added the treatment for next 4 months. In this schedule, we started Swarna Suchekar 30 mg, Muktapishti 30 mg, Low Basma 30 mg, Kutaja Brungaraj, Amalki Vidanga, Darudra Trikatu, Ela Nakeshar, along with Sarayavadya, so 20 ml for TDS dose. So the patient, after 3 months, getting good improvement and found that the only 20 to 30% improvement is remaining. So for that purpose, we stopped all the reagents we have used previously, and for next 4 months, we have started this medicines. So you can see on the slide, that is the impression in the ulcerative colitis is the patient was mentioned that having idiopathic ulcerative colitis extended till the hepatic flexure of the colon and the backwash iritis or biopsies is taken. So in the next protocol, mild left-sided colitis was only remaining. We can say that ulcerative colitis get converted into the mild colitis only, mild left-sided colitis only. So then after the 7 month of the treatment, we stop the medicines for the patient. This type of result we can see in the patients of autoimmune disorders. These are the only examples for the treatment purpose, for the slide presentation purpose. Another case was there. It is a case of urine microalbuminuria and rheumatoid arthritis. Patient was suffering from diabetes from last 17 years, having a rheumatoid arthritis from 6 years, and urine microalbuminuria from last 4 years. Prakriti of patient was with the sedentary lifestyle symptoms, common symptoms of diabetes, rheumatoid arthritis, urine incompetence, frequent urination, burning, micturition, etc. Ayurvedic diagnosis was Aamvaat, Mutragat, Ajirna. So patient was treated for 3 years with discontinuation by the patients. Treatment was given by the conventional medicines. Then Ayurvedic medicines we have started for the patient. Samagun Makardoj, Nilam Pishti, Vaikranta, Basma, Swarna, Samirpannak, Dashkundra Sindura, Mukta Pishti, Shwet Parpati, Yavakshar, Swarna Sindur, Siddha Makardoj. This is actually very prolonged case, and for this, because patient having multiple complications of diabetes, rheumatoid arthritis are also there, and after treating for 3 years for longer duration, patient got improvement in his condition. Now she is very fine. This is the patient's value of urine microalbuminuria, rheumatoid factor. Again, there is 29.4, and urinary microalbumin is 174. Which should be less than 25. After treatment, the patient's urine microalbuminuria was found less than 25, that is a 20.4 only. So this patient required treatment for longer duration, that is a 3 months, 3 years, for 3 years. And the medicines, multiple medicines we have used, and they change the regime for the patient. Out of these medicines, I can repeat the medicines which we used for the treatment, that is Samagun Makardoj, Nilam Pishti, Vaikranta Basma, Swarna Samirpanna, Dashgun Sindur, Mukta Pishti, Swarna Parpati, Yavakshar, Swarna Sindur, and Siddha Makardoj. So, as per the total, this is the now second last slide of my presentation, and after that we consider for the submission. So now we have used the Rasa medicines for the treatment purpose. How to use these Rasa medicines and why, on which parameters Rasa Chikitsa is dependable. Basic condition is the quality raw materials. Many times we have seen that the quality raw materials are not available for the Rasa. For the right now, due to the internet or due to the Google, etc., the knowledge of Rasa medicines or raw materials is increased from increase. But before 10 to 15 years, in many pharmacies or in many drug stores, we get Swarnamakshika Vimala instead of Swarnamakshika. iron pyrite was there and chocopyrite was not there. So like this, quality raw materials were not available. For the abraka, there are also many problems. Right now, we are getting good quality products due to the this internet facilities or this Google, or due to the increased identification procedures of the raw materials. Second thing, raw materials like herbals, which are we are using for the preparation purpose again, they having also quality products. Rasaushadi manufacturing procedures, yes, there are many number of types of Rasaushadi manufacturing procedures are there. Out of them, we have to consider the best manufacturing procedures for the preparation. Quality of finished product, yes, again the quality of finished product. In the Rasashastra, they have mentioned that the bhasmas colors are there, the organoleptic parameters were mentioned for the bhasmas. Like see, for the only Swarna bhasma, they have mentioned different colors: champe varna, jambu varna, the istika varna, etc. And all these we can prepare all these bhasmas, all these colors of the Swarna bhasma. So basically, according to the quality of finished product, the Rasaushadi manufacturing procedures are very important. Then dosage form of the medicines. Yes, the dosage form of the medicines which we are considering for the treatment. See, in the classical text of the Rasashastra, the dosage of the higher dosage of the medicines were mentioned. Like for Rasashastra, it was mentioned that 120 mg, like one rati dose was mentioned for the treatment purpose. But according to me, the dosage form of we need very small dose of the Rasashastra for the treatment purpose. Instead of 120 mg, we can use 2 mg or 3 mg or 4 mg, 5 mg also for the treatment purpose. And we are getting same results as per the 120 milligram. Because the doses were mentioned, the highest doses was mentioned in the classical text. We need to use the lowest doses also for the treatment purpose. And dosage form, again, the Anupana and Savapana, we need to choose very aptly for the treatment purpose. Duration of the medicine, I have told in the initial slide that the duration, we have to use rasa medicines for a very small duration. It means for the treatment purpose, 1 month, 2 months, 3 months. After getting maximum results, uh, we should consider for the herbal medicines, because if we getting 80 to 90% or 70 to 80% result within 1 or 2 months, we have to stop the rasa medicines, and after stopping the rasa medicines, we have to further shift the patient for the herbal medicines. Then the Prakruti and other examinations, many in the many classical texts of the Rasashastra, due to the hyperbolic quotations, they have mentioned that there is no need to assess the Prakruti and dosha of the patient. But according to me, or according to Rasratnam Samuchaya also, they have mentioned that yes, we have to consider Prakruti, Desha, Kala, etc. factors uh, for choosing the rasa medicines. So this is again a very important condition, that we need to choose the rasa medicine for the treatment purpose by considering the Prakruti, Dosha, Dusha, Kala, Bala, etc. factors. Some surprising reactions are there. Nag Basma related medicines we have to use very cautiously, and Vasana related Kalpa again we need to use very cautiously. So this is my humble submission here. Uh, According to time duration, I have completed, madam. So I am thankful to all of you for a patient hearing. To Rashtriya Vdyapeeth for offering me here, or for inviting me for a lecture. Thank you very much. Yeah, ma'am.
Hello, good evening.
Good evening.
Hello. Hello, Sanjay sir. Am I audible?
Yeah. Ah.
Uh, yes, sir. So this is Vaidya Savani here. I am an MD scholar of Rasashastra from Gandhaka Ayurveda College, Goa. So my
Yes.
question was, I have a couple of questions, but one of the question was regarding that you said the pishti, particularly of Mukta and Praval, have a better action than compared to Bhasma. So can you please share the detailed insight over that?
Yes, sir. See, in the text of the Rasashastra, they were mentioned that the Ratnas should be used in the pishti form. See, as per my consideration, when we are processing Bhasma preparation, in that condition, we use the highest heat for the Bhasma preparation. And the organic material from that Praval and Mukta, both are very lively material actually, and for that condition in the organic material get destroyed due to the heating process, and instead of using mukta and this valuable ratnas for the preparation of the bhasma, we can consider for the mukta shukti bhasma or praval mula bhasma, we can consider for the treatment purpose. So instead of using bhasma, we should choice for praval pishti or mukta pishti, because the organic material we can keep as such during the pishti preparation, but during the bhasma preparation we destroy the pishti, the organic material from that content actually, both praval and mukta, because both are very soumya ratnas. Hello.
Yes, sir. Thank you. So the another question was that the makar dhwaj that you are using, I think it has been self-prepared, right?
Hello.
The makar dhwaj you have been using, in particular the cases have you described, those makar dhwaj was being prepared by self, right?
Yes,
It was
yes.
self-preparation. Okay. So the question is, there is no single consensus, right? What is the percentage of Suvarna that should be there in the Suvarna Sindur? So what is your opinion and view over that? What should be the percentage of Suvarna, and does it matter that it should be there in that Suvarna Sindur?
Yes, sir. Actually, my topic was the post graduation and the doctoral study was only on the makar dhwaj. And in that study, we have carried out clinical trial, experimental trial, and the analytical analysis of the all those makar dhojas. In the first post graduation study, we considered for Triguna Balijat makar dhwaj prepared by Swarna Bhasma, Swarna Patra, and Swarna Varka, and we got shocking results in the analysis that makar dhwaj prepared by Swarna Patra having only 130 mg particles per million of gold. Sorry, 19. Only 19 ppm per particle per million in Trigun Balijat makar dhwaj prepared by Swarna Patra. Prepared by Swarna Bhasma, we got 121 particles per million gold in the makar dhwaja. And in makar dhwaja, Trigun makar dhwaja prepared by Swarna Varka, we found 400 particles per million gold in the makar dhwaja. See, here I have seen that makar dhwaja get sublimation of gold along with mercury and sulfur, but very trace element, in the very traces form. See, and again in the PhD, we have studied the difference between Trigun Balijarit makar dhwaja and Shadgun Balijarit makar dhwaja. The Trigun makar dhwaja, we found again 300 ppm particles per million gold inside the sublime makar dhwaja. But in Shadgun Balijat makar dhwaja prepared by Swarna Varka, we found 12,000 particles per million gold in the finished product. So this is the consideration that we gold is there in the finished product of the makar dhwaja. We can assess it by the inductively coupled plasma test, ICPS, and I have seen that due to the Gandhak Jarna process, we have seen that increase in the gold percentage inside the finished product. So yes, there is a gold inside the Makar Dwaja, a finished product of Makar Dwaja, and it gives differences in the clinical results also. It gives differences in the experimental results also. My papers are published for all these studies, analytical study, for experimental study, and for the clinical study. It is under publication. But in experimental studies, we have found that those Makar Dwaja having less amount of Swarna, having less clinical or experimental results, those Makar Dwaja having maximum amount of gold inside the finished product, having extraordinary results in clinical.
Ma'am, I have one last question. Can I? Okay. Sir, in the case of ulcerative colitis, in the first month of treatment, you use Yashad Bhasma. So
Yes,
what was the thought process behind that?
Yashad Basma is considered having Baladayi action on the Antragat Vedis. Hello?
Yes, sir.
For Antragat Vedis, to give the potency to intestines, Yashad Basma is considered in our text. So for this purpose, we have used Yashad Basma. And after getting the improvement that from the condition like diarrhea, etc., was found relief after the treatment. So we stopped using Yashad Basma, and instead of Yashad Basma, we added other medicines.
Okay, sir.
Again, along with Yashada, there is again a very good action of Makshik is also there. Huh? Makshik having a very good potential to improve the condition of the Antragat Vedis. But here we choose for Yashad Basma.
And so another thing was that you told that ulcerative colitis was turned into simple colitis, mild
Yes.
colitis. So after how long? I mean, after the mild colitis, how long the medicines were been continued?
No, no, no. After mild colitis, the patient was treated with only with I think so Rasavaidya. So for 7 months we use Rasaushadis along with different herbals and different Rasaushadis. After 7 months, the patient was just I think given only Sarivadya so for next treatment. Longer duration like 6 months to 8 months.
Okay, sir.
Then treatment
Thank
was
you, sir.
stopped. Yes. Hello, madam. My senior sir, Jogan Moda sir, having given one very great input for the question of Agni, sorry, Pishti preparation. He has mentioned that Agni Sannikarsa causes Ushnatva in Pishti, so better to go for Sita process like Pishti. Thank you. Thank you.